Hi, good morning Stalin. My name is Mihiraa. I'm your invigilator for the OET speaking session on the 6th of August 2021. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Stalin Fernandez.
And what is your candidate number, please?
My candidate number is 232481225.
Thank you. You are taking this test as a nurse. Is that correct?
Yes, correct.
All right. Can I see your ID, please?
Sure. Here it is.
Okay. The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
What are the qualities that a registered nurse needs to be successful?
A registered nurse plays a vital duty in the recovery of a patient and therefore requires many qualities. First, they should show compassion, or a great deal of care, by appreciating and responding to the needs of a patient. Communicate effectively with doctors and the patient, to aid in the latter's recovery. Be flexible enough to respond to different patients' needs, and ensure faster recovery. Be responsible for effective patient management and care, and exercise a great deal of confidentiality when dealing with patients.
Describe your daily routine as a registered nurse.
My day as a registered nurse is generally packed. I report to work early, visit my patients, administer medication, and update their records. I also check for any reactions or side effects and document them. The rest of my day revolves around performing physical examinations and diagnosis on other patients, collecting their health history, and reading and interpreting information necessary for their treatment. I also educate all types of patients and their family members on treatments and plans. All in all, I enjoy every part of the day.
What is the biggest challenge that you foresee in this job?
I have dealt with lots of challenges in my career, including 15+ hours shifts and uncooperative physicians. I don't, therefore, think that there's a challenge that cannot be solved. I expect the common challenges we face in the healthcare world, emotions running high, and having to break the sad news to family members, among many others. However, if anything out of the ordinary occurs, I will liaise with the right people and physicians to find a solution.
Why do you feel you are the most suited for this role?
I have been a registered nurse for 6 years, working in different health facilities and hospitals. I have dealt with several patients in critical and more stable conditions. My experience has taught me how to deal with several occurrences. I am also more patient, courageous, and confident while going about my duties, which was not the case when I was a young nurse. I believe that everything I have gone through in the clinics and hospitals has taught me to be good at this job, which will guarantee me success.
How will you educate and inform our patients?
I understand that part of my job as a registered nurse is to educate patients on several issues and keep them informed on several occurrences. I can effectively gauge every patient and determine whether they are in a position to understand whatever I am putting across. First, I will determine their preferred learning style to know how best I can educate them. While passing information, I will use lay people's terms and give them a chance to ask for clarifications. To gauge whether they have understood me, I will ask them to repeat the information and ask further questions where possible.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient or perhaps a relative and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there is anything you are not sure about and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your OIT speaking role play. Don't worry if I stop you when the time is up.
Good morning. My name is Stalin Fernandez, one of the registered nurses working in this clinic. How may I help you today?
Good morning, Stalin. I am here to get some advice regarding my daughter's headache.
All right. I am happy to help you. Well, for better communication, how may I address you?
You can call me Mihiraa.
Okay. Mihiraa, can you please explain to me in detail about your daughter's headache?
Sure, my daughter is 6-year-old and has been having a lot of headaches. Otherwise she is healthy.
All right, Mihiraa. Could you please tell me what bothers you exactly?
Actually, I don't think there is anything to worry about, but I would like to get some advice on how to manage her headache.
Yes, I acknowledge your words. In order to provide advice, I require more information. Mihiraa, can you please tell me more details about your child's headaches?
Definitely, her headaches started about 3 months ago. Since then, she experiences headaches 2 or 3 times a month, and will last for 20 minutes. More interestingly, it can occur anytime.
I'm sorry to hear that. Can you please tell me the area of the head affected?
Sometimes the pain is affected all over the head. And sometimes, she complains of a frontal headache.
Have you asked the level of pain she is experiencing?
Yes, my daughter says the pain is quite bad.
I am sad to hear that. Your daughter has been experiencing quite a lot of pain. Does she have any other symptoms?
No, nurse. She doesn't feel sick, and shows no other symptoms.
Good to hear that. I wish to know whether you have tried any treatments or not.
Yes, several times I have applied ice packs, and given paracetamol tablets for pain relief.
Thank you for your detailed explanation. Mihiraa, now, let me inform you about the headaches in children.
Okay.
Usually, if the child is having any tension, it will create headaches. Otherwise, the headache may not generally be caused by any concern. Another possibility is that the headache can be genetic.
All right.
Beyond this, I can outline some of the possible trigger factors of headache.
Okay.
Whenever your child feels tired, it can result in a headache. Or else, if she is consuming insufficient food and fluid, a headache is natural to occur. Talking about the activities, one of the major causes is excess screen time. Spending more time looking at digital gadgets will give your child a headache. In addition, any changes in routine diet may also create it. Mihiraa, is there any relevance of these to your child?
Talking about these factors, my daughter sleeps and eats well, but she probably doesn't drink enough water, especially at school.
Okay.
She also plays computer games a lot, and it's difficult to get her to bed.
All right.
She hasn't had any change to either her diet or her routine recently.
I am much obliged to you for providing me the details. I wish to suggest to you some of the ways to prevent headaches.
That will be of great help, nurse.
The most important and basic change needed is the consistency in daily routine. Consistency in sleeping, eating, exercise is very important. Along with that, make sure the body is well hydrated in order to perform effectively. Above all comes the rest. Find sufficient time for relaxing.
I think these are really useful suggestions.
Glad to hear that. Mihiraa, the next thing you should make sure of is the reduction of screen time before bed. Spending too much time looking at the screen will not only cause headaches, but also vision problems. And sometimes, vision problems can also lead to headaches.
Yes, nurse. I understand that.
I would like to provide some recommendations to note down for diagnosis purposes. Try to maintain a diary to write the notes about your daughter's headache. By noting the points in the diary, we will be able to identify the specific triggering factors.
That is a good idea. I will maintain a diary.
Perhaps, I also suggest you make a doctor's appointment for your child. It is nothing but to rule out any underlying causes, if they exist.
Well, nurse, if my daughter needs to see a doctor, there must be something wrong with her. Isn't it?
I realize your thoughts. Don't panic. I will explain why I suggest the doctor's consultation.
Okay.
Why I recommend the doctor's appointment is that as a precautionary measure. By getting consultation, the doctor will be providing reassurance about your daughter's condition. On the other hand, if she requires any attention, the doctor will be able to provide further advice as well. I hope I made the suggestion clear now.
Yes, nurse. It is clear for me now. Surely, I will take my daughter to the doctor, just to be sure, and I will follow all that advice.
Thank you for your understanding and acceptance. I hope I have cleared all your concerns. Please feel free to contact us for further queries. I wish your daughter a speedy recovery.
Thank you. That is the end of your OIT speaking role play. All the very best.
Thank you.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.